Hello, we are from Group 2, so we perform the general physical examination, and it is our patient today, which is a young man who is moderately built and well nourished. He also conscious and mentally oriented. And my name is Muhammad Iman bin Aimi. They perform the general physical examination on this patient today. Can I start the examination today, sir? Yes, you can. First letter is P, is stand for failure. So to check for failure, we ask the patient to look up and we check at lower palpebral conjunctiva. And then the second is we can check at the tip of the tongue. Can you open your mouth and we check at the tip of the tongue, and also we can check at the finger of the patient. So there is no failure in this patient. Next letter is I, which stand for icterus. To check for icterus, we check at the three part, which is first, we can check at the sclera of the eye. We can ask patient to look down and pull out the upper eyelid. We also can check at the palate of the mouth. Open your mouth. And also we can check at the nail bed of the fingers to check for any jaundice, which is yellowish coloring of the skin. The third letter is C, which is stand for cyanosis. To check for cyanosis, there are two cyanosis, which is peripheral and central. To check for the central cyanosis, we can check at the face of the patient, tip of the nose, also at the tongue of the patient. Can you open your mouth? So for the peripheral cyanosis, we can check at the tip of the finger of the patient. So there is no cyanosis in this patient. The letter is also C, which stands for clubbing. To check for clubbing, we call a test scram rod window test, which is we ask the patient to meet the two fingers like this and check for the diamond shape between two fingers. In this patient, there is a diamond shape, so there is no clubbing. Clubbing is negative. So for the letter is L, which is stand for lymphadenopathy, which is the enlargement of the lymph node, which is we can check at the three region. First, at the cervical region, axillary region, as well as groin region. So for the cervical region, we ask the patient to slightly flex his neck, and we check at the submental, submandibular, preauricular, postauricular, at cervical, occipital, supraclavicular, and infraclavicular. So at the axillary region is first anterior, posterior, medial, apical, also lateral. For the both side. Also, we also check for the hepatos and splenomegaly. The last one is E, which is edema. We can check at the neck of the patient and at the leg of the patient. There are two types of edema, which is pitting edema and non-pitting edema. Which is for the pitting edema, when we press, the depression is still there after we lift our fingers. But in this patient, there is no edema. Now we will check for the vital sign, which is blood pressure, pulse rate, and also as temperature. So first, I will check for the pulse. So the pulse rate of the patient is 74 beats per minute. Now we check for the blood pressure. Blood pressure reading for this patient is 170/72 mercury. We check for the temperature, which is we place the thermometer at the axillary of the patient. The temperature of the patient is 96.7 degrees Fahrenheit.
Hi, good evening. So we are from Group 2. We will do per abdominal examination. So basically, there are three types of per abdominal examination, which is acute, chronic, and trauma. So for learning purpose, I'm going to demonstrate the chronic upper abdominal examination today. So this is my patient, Mr. Azri. Hi Mr. Aziz, I'm Muhammad Aiman Nasrul. So for today I will demonstrate to you or perform on you per abdominal examinations. So do you have any question?
No.
So do you give consent for me to perform the examination to you?
Yes.
Okay, please lie down on this bed. Okay, now Mr. Aziz, I'm going to perform to you per abdominal examination. So can be relaxed and breathe in normally. So basically there are 4 sequences in doing per abdominal examination, which is inspection, palpation, percussion and auscultations. So Mr. Aziz, can I expose your abdomen, which is from the sternum to the groin area? Mr. Aziz, please flex your knees. Thank you. Now I'm going to inspect the shape of the abdomen, whether it is scaphoid, flat, rounded or protuberant. So in this patient, the shape of the abdomen is flat. Next, I'm going to observe skin and subcutaneous tissue in this patient, which is I'm looking for any swelling, scars, hematoma or any engorged vein is present. Also, I'm going to look for umbilicus, whether it is centrally located or not, and the shape of umbilicus, which is if inverted, everted or smiling. And I also going to observe the movement of all the 9 quadrants with respiration. So Mr. Azri, please inhale, exhale, inhale, exhale. Next, I'm going to observe if there are any hernia is present in this patient, which is normally at the location of epigastrium, supraumbilical, umbilical region, infraumbilical and paraumbilical region, and the last one is at the groin area, which is inguinal hernia. So to check for the hernia, we need to ask the patient to cough. Mr. Azri, please cough. So there are no hernia. And then the last thing is I need to check if there are any swelling at the scrotal. Palpation, which is we have 2, light and deep palpation. Before we start the palpation, we need to ask the patient if there are any pain of the abdomen. This point is very important because we need to start our palpation from the farthest area, from the pain sides. So in light palpation, we have 2 components, which is we're looking for
temperature and tenderness.
So for the temperature, I need to check all 9 quadrants. And then for the tenderness, next we move to deep palpation. In deep palpation, I'm going to palpate 3 main organs, which is liver, spleen and kidney. To palpate the liver, I will start from right iliac fossa. So for every aspiration of the patient, I will move my hands upwards. So Mr. Azri, breathe in.
Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out.
For the liver palpation, we have to comment on 3 things, which is consistency, whether it is soft or firm, surface, which is smooth, irregular or nodular, and the last thing is if there are presence of tenderness. Next, to palpate the spleen, I will use the same technique to palpate the liver, but the difference is I will start from the right iliac fossa and then I will move diagonally to the left hypochondrium. Normally, we cannot palpate the spleen, but only in case of the spleen is very enlarged, which is 2 to 3 times larger from the normal size. Next, to palpate the kidney, I will use bimanual palpation, which is I will place one hand behind loin at the renal angle, another hand I will place at the abdomen just below the costal margin, and I will ask the patient to take breath deeply. Then my behind hand I will push anteriorly. Take breath. So basically I can feel the movement of the kidney with respiration. So this is the development of the kidney. Next, I will percuss the liver to know the liver spans. So basically I will start from the second intercostal space, resonant, 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 dull. So once it is dull, I will ask the patient to point or I will mark with pen. So basically, I will ask the patient to put their hand here, and I will continue to percuss. Okay, so the last dial is here. So basically, we can measure the liver span. I will percuss all the 9 quadrants of the abdomen. Next, I will perform shifting dullness. So I will start to percuss from medial to lateral. Medial, normally we will hear tympanic sound. As we move laterally, we will hear dull sound. So once I hear dull, I will ask the patient to move laterally. Mr. Azri, please. So I will wait 15 to 20 seconds so that the fluid can settle down. And then I will percuss again. So the last dull sound will change to tympanic sound. And then as I move medially, I will hear dull sound instead of tympanic. So this is positive shifting dullness. Next, I will perform the fluid trill. So basically, I will ask the patient's help to put his hand vertically on the midline of the abdomen. This is because I want to cut off the transmitted wave of the subcutaneous tissue from one flank to another flank. Then, I will put one hand on the other flank and another hand I will gently tap from this flank. At the same time, I will feel the trill from this hand if there are positive tests. Next, we move to auscultation. So in this procedure, we do not have to rush because for 5 to 10 seconds there will be one bowel sound is heard. So normally there are 5 to 30 bowel sound per minute. So I will auscultate all the 9 quadrants. Next, I also have to check for the aortic aneurysm, which is I will auscultate at the abdominal aorta. Basically, in complete per abdominal examination, I have to proceed with per rectal examination. But in this patient, the patient is refused to proceed with per rectal examination. So we can conclude the per abdominal examination until here. So I will thank the patient for the cooperation. Thank you, Mr. Azri.